We've got one of the highest incidents of cardiovascular disease in the country. People present to the emergency department at Blacktown with chest pain, and we have very tight processes in how we evaluate patients as they come through and provide timely access to diagnostic services.
When Graham came home, the day he came home, crikey, we walked into that house. Now I'm going to cry. And he said, I didn't think I'd ever see this house again.
The most common symptom we think about with the heart is the crushing pain, and not everyone gets that. And that can really be a big problem sometimes, with people not identifying shortness of breath, sweating, dizziness, nausea as a potential heart attack.
I get asthma, and I was going to see the local doctor, which Graham forced me to go, which I didn't really want to go, but we went. He listened to my chest, it was all clear. And the doctor leaned over to Graham and said, how are you going? And he said, I get a bit of heartburn. And he says, let's do an ECG. So he did have the ECG, and the doctor says, oh my God, you're having a heart attack. Go to the hospital straight away. So we came to this gorgeous place.
20% of people never survive to make it to hospital. And a lot of that could potentially be reduced if people were aware of these symptoms and sought attention early.
I was resting on the couch, and I had this feeling of choking and a tingling in my jaw. I realized that it was not normal. And later on, my doctors told me that you're lucky that you started having that feeling again. When you were driving back, you're not reached home. There was no damage done. The reason why your heart is 100% is because you decided to come to the hospital in time.
We know once someone makes it to hospital and gets successful treatment and has the blockage cleared, their chance of survival to 1 year is 95%. If they don't get that treatment, the chance I'll be alive at 1 year is 66%.
Yeah, I thought it was just heartburn. It's kind of like, but it's weird because I never used to experience that. So 99% blockage, that's scary. They had me to do the surgery the next day. They just can't wait because I'm at a high risk. It's the right call to make. So if I probably would have kept that wait another week or two, I probably wouldn't be here talking to you. Yeah.
If in doubt, we want people to come in, get checked out, come to Blacktown Hospital for treatment, because we have the leading treatment in the world.
And we certainly know in some of the cultural groups there is a higher incidence of cardiovascular disease, particularly in young men. There is a group of patient where we need to get them to the cardiac cath lab within an hour of presentation to the hospital.
With the help of the Better Foundation, to improve the equipment that is life-saving for heart attack victims and patients having other acute cardiac events.
I literally remember she was a very nice nurse. She came and scolded me. She said, are you in your senses? Like, do you know what has happened?
God.
Your side had a blocking artery. Yeah, they called it the widowmaker. Yes. Like they said, another 10 to 15 years, give you more life. That's excellent. You don't argue with that one bit.
I consider myself lucky. I mean, I'm just a patient that was before me the day before I came in. He's younger than me, a young family as well. And unfortunately, he didn't make it. And the nurses there were so, you're so lucky because you're at the same path, but this guy didn't make it, and he's much younger than you.
Shockingly, we see young men, even in their 30s, having a major heart attack needing treatment.
At our cardiac rehabilitation facilities at Blacktown and Mount Druitt, our equipment is utilised on a daily basis for patients' convenience to reduce their risk factors, to increase their fitness, and also to help them psychologically develop resilience.
One of the challenges for us moving forward is obviously meeting the demand, and we know that demand is ever increasing.
There's always potential for us to improve that equipment, upgrade it, which provides better, faster treatment for the patients and gets better results. So with the help of the Better Foundation, we're seeking generous donations to try and make sure we can ensure Blacktown patients get the best world-class treatment for all of their heart needs.